All right, we are back with Lesley Fleming in part two of our interview about private practitioners. And Lesley, again, thank you so much for spending some time with us. This is really
Mhm,
fantastic information that I know is really useful and helpful for the students kind of understanding that the big picture.
mhm.
And so what I want to do now is kind of talk a little bit about some of the logistics. But before we do that, I want to ask you, what do you think are kind of for you anyway, and I know it would change from person to person, but what really are the three best things in your mind about being a private practitioner in horticultural therapy?
Right. I think that's a great question, Lee. And I think for sure you have to think about the pros and the cons of what your employment setting is going to be in this field. For me, the best thing about being a private practitioner, but more generally an HT, is working with people and seeing the satisfaction and the transformations that you can bring. So that would be number one. But in terms of being a private practitioner, I think many of us would say it's the flexibility that the contracting structure allows to set our own schedule. We're our own boss. We can choose the variety that's in terms of working with multiple or single populations, working at one type of facility or across different organizations, and creativity. I think that's probably a big one for me, that we can choose the activities that demonstrate or utilize our personal talents. And for me, that has always included creativity and creative expression activities. Not all of my activities were soil based, which suited my tabletop programming more than, say, a greenhouse site. And so that spoke to my strengths. And I think that's something that, as a private practitioner, you have to be aware of. What are your strengths? What are your preferences? Does it fit within what horticultural therapy or therapeutic horticulture allows? And, use those foundational tools. But other than that, it's kind of an open slate. And I think if you talk to more than one HT, you're going to find that what they deliver and how they deliver and the activities that they choose, there's going to be some similarity. But I think if you wrote a list of all of the activities that we did in a given year, it's going to be, well, it would be a good resource for picking up good ideas. I'm sure there are some sessions at the conferences on just that topic.
Yep. Well, and I will say that I've really, one of the things I've appreciated in working with you is that you are so creative about ways to engage people and, whatever person it is, and really creative with your materials and the sensory stimulation components of that. So I've really
Mhm,
learned a lot of great stuff from you in terms of that. And I agree, that is one of my favorite parts, even not being a private practitioner,
mhm,
is because I do in my setting have the ability to
mhm,
do have some freedom with activities, but just to
mhm.
really be creative about the activity, but also creative about how you engage a particular individual in that activity.
And I think that's key because if it becomes rote or routine, then you probably aren't engaging the people you're working with very well. And I think part of what we do is, and this is a professional training, we have to constantly evaluate. And so if it comes around and I'm doing door swags at holiday time, this time of year, and I'm just, the words are just coming out, I'm not thinking about it, then I need to go somewhere else or get a refresh or do a different activity. So, I think that is part of being a trained and productive practitioner, whether you're a private contractor or other.
That's right. And that also is, and you've mentioned this a couple of times, that's why connecting with other professionals and going to
Mhm,
conferences is so important every time. I mean, both of us have been to
mhm,
many, many AHTA annual conferences, but I always come out of those refreshed, excited with some new ideas. And so
right.
whether it's going to a conference or it's being in a networking group or something, that's such an important way to stay excited yourself and energize yourself about what you're doing.
Right. Same with the webinars that are now available. I mean, HTA has delivered two really wonderful webinars, two more in early 2020, and, they're free. Oh my goodness. How much better does that get?
That's for sure. Yep, that's great. Okay, well, now let's talk about the flip side. So, what would you say are the most challenging or the least favorite three things, aspects of being a private practitioner in horticultural therapy?
Right. I think the top one I would have to say is it is difficult to earn a good living. You can do things for free and you can probably earn a living, but you don't have health benefits, so you have to take that in account of your fees, and it is difficult to earn a good living. Now, some people, and again, have a knack, they have that entrepreneurial spirit, and they just are able to get programs in a whole lot of different places. And I would mention Robert Bornstein, who's in South Florida. And every time I talk to him, and he is an HTR, and that makes a difference, being an HTR versus someone with an HT certificate, you are able to show your credentials. And I do feel most people acknowledge just that higher level of training and professional and, well, credentialing. Some people, that's just them. They must be part salesman and part HT. I don't know. I wouldn't describe myself that way, but you do have to be very entrepreneurial. And if you're in a large market that can support the number of programs to make a good living, and that's going to be a little bit easier. One of the challenges we have in this profession, and I would say this is a hard thing of being a private practitioner, there is no third-party insurance. So facilities cannot easily fund programs as they do for occupational or physical therapy. This is an issue that we have been talking about for 20 plus years, and it continues to be a bit of a barrier. The second hardest, another one would be assuming all the tasks, and that includes the business acumen, the budgeting, the invoicing, along with the HT skills. You may have human resource problems. You have to be a good plantsman. As a contractor, you have to please many masters. You don't just have one employer, and that, can be a little challenging. Another barrier I would say is there's virtually no awareness of the horticultural therapy profession among potential employers. And that's in health services as well as education. I see it in corrections. I think the national professional associations try to market. I think we, and former board member, we have to do a better job at that. But when you're starting to explain and they have no idea what horticultural therapy is, and then you have to go into all that detail, that is a barrier for sure. We will look forward to the day when that's not the case. And I do think some communities, that's an easier go. I mentioned a few of the hubs of HT. So if you're fortunate working there, I think you maybe have an easier entree into some of these facilities, but then you're probably competing with more HTRs delivering programs.
I think that's true, and I feel, and you're in Florida too, but I do feel like that is starting to slowly change here in Florida, and maybe it's
Good.
because UF is doing
Hmm.
more with horticultural therapy. Maybe it's just because we're slowly chipping away at that nationally. But I think that, and you said this earlier in the first part, how important it is to have that elevator pitch
Hmm.
and to be able to come in with some resources to provide, whether it's a activity description or like you said, it's an actual product or something like that, how important that is.
Hmm.
Because I think one of the advantages of horticultural therapy or therapeutic horticulture as an intervention is if it's explained well, it's easy to understand. And I think
Right.
many of us, whether you're a hospital administrator or you're a high school teacher or whoever you are, can, if you are given the opportunity, you can understand inherently why that might be a good thing. But we, as the person approaching with that information, need to be well spoken and choose our words carefully and make sure that we've thought about how we're going to introduce that. Because you're absolutely right, there's still lots of people out there that have never even heard the term horticultural therapy. And
Right.
as we all get, oh, were you, or you have sick plants that you're taking care of or something like that. So to really sort of help advance the understanding is a part of any person's job in the horticultural therapy field, but especially I would think private practitioners.
Right. Well, and I would like to thank you and University of Florida for delivering the certificate HT program. This is something that has been in the works for at least a decade, if not longer. And this is part of the marketing scheme. That's a large agricultural college, isn't it? The largest in the country. And so when you have people, the emerging professionals who have taken the courses, then they're going to be promoting and doing it. So I think we each have a role to play. I'm not putting it all on the professional
Oh,
association,
no.
but nationally, I think, they have a few more chops than we as individuals do. So
Yep.
yeah, something that we all work
Yep.
towards.
I agree. I agree. Okay, so let's ask or talk a little bit about some logistics. When you go to a facility, is it typical that you're on your own, or are there often staff or maybe volunteers that are associated with that particular facility or organization that might be there to help you deliver programming?
Right. That varies and it depends on the organization. And again, that collaborative initial talk that you have, what are they looking for? What are their needs? I would say for senior facilities and probably skilled nursing hospitals, there probably are not staff or volunteers who are going to be your assistants. You can ask for that and you can see if that will happen. And there may be some volunteers, but typically my experience has been that I deliver the program on my own. You are reliant on staff to bring the clients to the program areas, and typically they'll leave because they will have other duties. Um, One program that I delivered was in a hallway, and staff were constantly interrupting the session. And this was an issue that, for example, I had to resolve because it was really disruptive to the clients, and I have to say to me too. So the resolution for that was I had some short sessions for the staff to do the activities. They found the activities were very interesting and they wanted to learn about plants, and it benefited me because then they would bring more people. And yeah, I've had some programs um, decline because the staff were not bringing people there. So you have to maintain good relationships with staff and move forward. And you have to keep in mind also that though we're engaging the clients, we're also, our work impacts many, the clients' families, the staff, the cafeteria workers, the maintenance people. And so, we're one, it is a collaborative affair, even though most of the work rests on me as the credentialed HT. Volunteers, I guess I'd like to just make a few points there. If you're going to have volunteers work with you delivering therapeutic horticulture or horticultural therapy, they need to be trained by you, by the professional, because ultimately we have the responsibility and the safety of participants and the HT standards of practice that we have to comply with. And, that is part of the ethics and the discipline and the professionalism of our field. I have worked with volunteers in several capacities at several types of programs and facilities. I have done training. I do require that when I haven't been as focused on that. There have been some issues, and you're going to have issues with volunteers whether they're trained or not. So, in some ways, it's easier to manage yourself if you can deliver a program in the numbers that the facility wants and you don't need volunteers or staff. You're going to control yourself. You're not going to have that added dimension of volunteers. On the flip side, the volunteers can bring some wonderful attributes as long as they understand and respect, again, the standards of practice. Not everyone who wants to volunteer, I would say, is a good fit for delivering programs, but there is probably a role for every volunteer, whether it's fundraising or tending the garden, or there is a role for them. As a matter of fact, I wrote a couple of articles, one with Patty Cassidy, HTR, which I'll send to you, which you can share with your students, Lee, on managing and working with volunteers. And I think between the two of us, we probably came up with many of the scenarios that you might fit. Some organizations, they do like to have a large volunteer presence. And so that may be a requirement that is placed on a contractor. More often, an HT employee, that they have to involve volunteers. So, I think, again, you got to be flexible. What works? What can you ask for? They can only say no, let's modify it. And, what works best for the client.
Okay. And I just want to go back to something that you mentioned because we've talked about this in class is that as you were talking about staff and educating, having the staff actually participate in activities, it's so important for us to remember in any practice situation that those direct care workers, the direct care staff are the ones that can make or break our programs in some
Oh,
way.
totally.
They're interacting directly with the clients, the participants, the residents. And if they don't understand something and they maybe explain it wrong to somebody, it could mean that that person decides not to show up. So it is really important for us to be proactive in really helping the staff to understand why we're there and what we're
Yeah,
doing, that kind of
right.
thing. And the same goes with volunteers because they can really
Yeah,
serve as ambassadors in a sense.
exactly. And I think maybe in a private contracting situation, we're evaluated on every session. If, and I mentioned this earlier, if there's one session that goes awry or one client that isn't happy, that can end your program. In an employee, HT employee situation, you're probably going to get a warning or a discussion. That's not the case with a private contractor. So I think that holds us to a higher standard. It certainly made me evaluate after every session. If I felt there were issues, I dealt with them immediately. And I did have ongoing communication with the administrators. That was critical.
Okay, great. Let's see. What has been your typical frequency of sessions? I know you mentioned that sometimes it's a one-time thing, but that more often you would rather it to be sort of an ongoing session. How have you found that both in terms of how long the number of sessions might be, but also, is it once a week, once a month, how that has played out?
Right. That goes back to your initial discussion with the facility person. What are they looking for? And then what information can you provide to them? Of course, if we can do a weekly session, we're going to engage the people we're working with better versus once a month. But some facilities, they're not going to have the same clientele. They're going to, be in and out. And so they may want a program every 6 weeks when they have their next intake. So there are a lot of factors that are going to be dependent on their frequency. And these include how you market the program, which is a point I just made. You've got to sell it a little bit. What the budget and scheduling of activities are at a facility. Several times I went in as the new program and they said, like, we've got one slot for you every 6 weeks, once every 6 weeks. Well, then when the people enjoyed the program and there were good health outcomes that I could demonstrate, then that frequency increased. So part of it is a process. Another key factor are the health needs of clients. And so if what we're delivering really has a positive health impact on clients, and for several of the programs that I ran, this was something as simple, although we know it's more complex that I'm going to state it here, is taking people outside, access to nature, access to sunlight, which reduced agitation. And so a lot of the other programs or the facility staff, they just didn't have time to deliver or take residents or people out into the garden. Another determination of the frequency, what are you willing to do? I've been asked to do a 20 or 30-minute session. Well, no, I'm not willing to do that. That's, too much prep time. And in some instances, I just had to decline. They were not a good customer for me. Other times I was able to expand that. I had one set up where I basically crossed the parking lot from a memory care facility to their affiliated assisted living session. And so I think one of the sessions, probably with memory care, was 45 minutes. So we negotiated a bit. But, again, I think you have to be flexible and figure out what's going to work for everybody. I would say that many of the sessions that I delivered are monthly. Many of those would be at seniors facilities. It is a challenge to sustain programs and engagement when you're delivering programs monthly. The more frequent, I mean, hey, if we had our way, we'd do it daily. But certainly with financial constraints, as I experienced in 2008, and now with COVID, many programs have been cut. They are cutting the frequency. Um, Another point that I'd like to share is I found that if I took an extended holiday, which I like to, I am a dual US Canadian citizen, but I do spend a fair amount of summertime in Canada and do some work up there. If I was away for more than a month, one year it was 2 months. When I came back, they weren't as willing to, pick up my program, even though I had established reputation. But, they had to move on with other programs. So, a whole lot of factors to take into account.
Yep, that's important to consider. Do you find, or would you think that as a private practitioner, are there certain client groups that are easier to target? You've mentioned, I know you have a lot of experience with older adults and assisted living facilities and that sort of thing. Are there particular types of facilities or types of client groups that are a little bit easier to work with as a private practitioner?
Right. Mm. I think probably how I would respond to that question, Lee, is that should really depend on what populations the practitioner is comfortable or experienced working with. That should be the overriding factor, I think. So, are you willing to work with seniors? Do you like working with children? Are you comfortable and knowledgeable working with people on the autism spectrum? Aut- Spectrum range. Are you willing to go into corrections facilities? So some of these may be easier because you have a contact or not. Let's face it, there's lots of school gardens out there. But if you're not comfortable or wanting to work with that population, then I think you have to look at other facilities or types of programs where you are comfortable. And I would say to emerging professionals, you're going to gain experience. And so in my case, I wasn't comfortable working with people who were incarcerated initially when I began my practice, but then I was exposed to more. I got more training, and I did end up doing a program at a county corrections facility. Um, Programs not requiring or wanting charting probably are easier to set up. Um, but of course, I think the HT needs to have the knowledge of the treatment process and of setting goals and matching activities to outcomes. But I think the costs are going to be less. And so new programs are probably more easily set up at facilities who do not want horticultural therapy, the clinical application. I think it's probably easier to get face-to-face contacts at organizations like Boys and Girls Clubs, botanical garden staff, probably seniors facilities. And I'm saying this in comparison to identifying and finding someone who works within a hospital to pinpoint the precise person you need. And let's face it, it's easier to have no said to you or vetoed. You then can't turn around and say, well, I'm talking to them. I mean, you can, but I'd also say personal contacts is important. That can provide entryway into different facilities. I would ask other HTs in other communities what organizations and groups they're working with, like Catholic Charities. That was not a group that I worked with, but a couple of years ago, that seemed to be an important organization working with refugee and immigrant populations. And I know other HTRs were working with that organization. I mean, the other option that you have is writing funding requests, which then can provide a program for you to work at. But this requires a lot of effort, and there may not ever be a program from which you would be paid. And it also requires a relationship in the place with the sponsoring organization. And so typically, if you already have that relationship, you're going to dive straight in and do the program. And maybe then you would write a funding proposal to expand your program. That's probably the more likely scenario. Or at many of the facilities that I was at, they had a garden that the staff were using. The residents or clients never were taken out or allowed into that garden. And so it was my role to suggest, let's use that space. Do we need to get some funding? How can we go about doing that?
Okay, that's all good stuff. So, how do you handle material storage? You've talked a lot about tabletop programs, but that even if you're not dealing with soil, you're still dealing with a lot of materials. So, I guess
Right.
it's a two-part question. One, how would you think about sourcing those? And then two, how do you actually store them? Do you have to take them home with you every time? Do you usually have storage at the facility? How does that work?
Can you say garage? My own garage. Yes, use your own garage or basement. I have never, ever been able to store materials at a program site. Part of that is my preference, and here's why. I have had some scenarios where I have left plants growing. So the first session in a multi-session, whatever it was, program was, we plant the plants and we leave them there. To be used in subsequent sessions, and then they had gone missing. So, there's a bit of a security issue that goes back to communication relationship. But even that, there are lots of people in and out of facilities. Um, I use my own scissors, my own gloves, my own soil containers. I try hard to pack the materials so that I can get them into the site in one trip from my car. This is harder with plants. I do use a cart. Why lift if I can carry, and carry it when I can roll it? So no, I don't typically store them. But again, I think there would be some communities and some practitioners who would be able to establish relationships, and maybe they would be given a secured locked cabinet. I don't know, I've never talked to any of my peers where that has worked, so that's how it goes. In terms of purchasing and maintaining and storing plants, to me there are several options here. The obvious one would be grow your own plants. And, for some of us, that's easier said than done. In Florida, we have year round gardening, so that's not as big a deal. But, it's, some people don't want to do that as part of their practice. Purchase as necessary in quantities you've planned for. I think that's key, because I would say, in terms of making a living, wasting resources and overbuying or overspending, you really have to keep your finger on that constantly. And back to working with volunteers, I did find that when I was paying for this and really paying attention to the costs, the material costs, that wasn't always the case with volunteers. And, when I thought I had brought materials for 2 sessions and we had used all of them up in one session, well, the lesson for me was I have to track that a little bit better and work with the volunteers a bit better. Um,
And actually, can I insert something here? Because you just made me think of something. One of the things we've found at Wilmot, as part of that, is that oftentimes when a group comes to us, they may, in certain situations, they may come with a staff person or, somebody from their area. And we don't typically think about including that person in the activities, but often they are. And I think there's a lot of good reasons for them. It's a great way for them to participate with patients or that kind of thing.
mhm,
But we have learned that we need to make sure to not only have the materials to include that extra person or three
mhm.
people, but also to budget for that, because
Yes.
the same kind of what you're talking about, we often find that, they're participating. And so we need to make sure that we're not ending up paying for that ourselves.
Right. And I think that speaks to, we have to evaluate and then adapt the programs that we're delivering. When in fact, we may have structured the program or the activity to work with veterans, but they are coming with a companion. The companion, if they're participating, they are also deriving some health benefits. And the main one, I would say, and I know you see this with the programs that you're running, is they see their care partner or the person that they are accompanying in a different light. They're playing a different role. And that is so, so very important for both the original participant and the care partner. So, yeah, I think, budgeting, sadly, it comes down to a lot of that. And I would say that your greenhouse is fabulous at Wilmot Gardens. You have the capacity, in a nice space to um, allow more people to participate. Often I had one table and, the capacity there was 8 to 12. And even if somebody wanted to join in, it wasn't appropriate that they hover. So then, again, we adapt. But yeah, I think, yeah, it's sadly about budget. Now, in terms of sourcing plants, other than growing my own, which, I did do that, but I wouldn't say I was growing as many plants as peers that I speak to. I used multiple stores. I did buy some plants that were wholesale, some that were not. There were some plants that I relied on as kind of the mainstay that were important for a good number of my activities. I used a lot of rosemary, for example. I used theralis, which is a flowering shrub in the south. I used a lot of greenery as filler. Right now, there are free pine boughs available at all of the Christmas tree stores. And I always did an activity where I could utilize those. That helped with my budget. And so going back to the different dimensions that a practitioner has to know, and again, I think this is the same for an HT employed, at a facility, we all want to be budget savvy. And if we know certain times of year, there are going to be plants that are more plentiful, well, why would we not plan for programs, utilizing those? In January and February, I typically do citrus sampling because citrus is more plentiful in Florida. Of course, I have to be aware of the safety and swallowing challenges that some of the participants may have. But, that was a nice nutrition focused activity, different than a soil based activity. So, I think tying into seasonality and what plants are available during different seasons is just a smart approach. I think if people have horticulture tendencies and they've come into the profession, this is probably second nature to them. But, I also think you have to be Johnny on the spot. One of the things that I noticed was in my gated community, the maintenance staff or landscape crew would change out annuals for the different seasons. And if I had a tarp in the back of my car, I could stop and say to them, hey guys, you're throwing these out. Can I take them? And then I was able to use them in my own programs. They weren't so large, they were good for transplanting. So again, it's that creativity that, sometimes comes into play. Challenge yourself.
Yes, exactly. And if you do have the storage space, like we certainly do at the greenhouse, I will go after Christmas or Halloween or whatever the holiday is and scoop up as many decorative, things for
Hmm.
75% off. As long as
Right,
I have a place to store them, then that's
right,
really helped my bottom line in terms of my budget for the next year around.
right.
And that can help a lot. So again, as you say, being kind of creative and just keep your eyes out for different opportunities that come and go.
Yeah,
So getting, seeds usually is, I think through Master Gardener programs and other places, getting seeds for free, if not very
right.
low cost, is usually something that's pretty easy to do. And those are very easy to store.
Yeah,
So,
that's good. All good ideas.
yep. So I'm just trying to think. I think that is pretty much because you did talk a little bit about the different kinds of settings. You mentioned that you do work
Hmm.
both in the garden, but most often kind of at tabletop. So can you think of any other kinds of information that we didn't touch on that you think might be helpful for the students?
I think it would be interesting, possibly for emerging professionals, to hear from people, not necessarily me, about the types of programs and the facilities they're working at. I think a lot of that, again, comes down to the key points, knowing your population, what variables different settings might have. For example, delivering programs at public botanical gardens to me is very different than working at a corrections facility. So if you're going to have another iteration of this, that might be, one area, and maybe you can poll your students on whether they're interested in that. I had written down a few other points when you posed this question to me. One question that I've often been asked is, do you set up your own business or not as a private practitioner? And I'll just quickly touch on that. Some contractors will set up a separate legal entity for their business. That was not the route that I chose to go because it involves a lot of paperwork and time and expense. And I didn't feel that I needed it given the level of activity that I was going to be doing. Separate from that, but I think often lumped together is liability insurance. So just because you may set up your private practice as a separate legal entity, you do not necessarily get liability insurance, which we all need to have. As an employee, you would be covered by, the organization. For me personally, I felt that my family, we had sufficient liability insurance. And, that was a factor that I looked at carefully and looked at it with my husband, who is a business person. And that was a conscious decision. But nobody wants to be sued, and you do have to protect yourself. So I think, you have to give that some consideration. One of the other areas, problem solving. There are some problems as a private contractor that we haven't touched on. One is not being paid. So you have to think about how you're going to deal with that. Do you give them 30 days on the invoice, and what do you do? I have had programs where have not gotten paid. I have had to end the program. I did do some pro bono work because I knew the situation of the nonprofit, but, they kind of took advantage and let it go on too long until I kind of went, wait a minute, this has been going on for a year. I need to have this discussion again. So that was on me as much as on, but, that's an important factor. Another problem that we see as contractors, staff turnover and lack of continuity. So, we go and we think we have everything set up, and we arrive and it's somebody different. We don't know who to phone for problems. So that's an ongoing issue, I would say, with every program. Another one is feeling staff is not satisfied, and they may never be satisfied. And I had said not everyone is a good customer. So as a private contractor, we're more attuned to that, or we have to be, because as I said, maybe your program will end. Somebody didn't like the fact that you brought in such and such. I think you have to constantly review your own skills. And I think with training, all HT should be doing this, but I think it plays a greater role in sustaining your programs as a private contractor. And then
And
lastly,
Leslie, can I just
yep.
interrupt there because you made me think of something? I do think that sometimes we may be delivering a program, and as you mentioned earlier, we may think it went well,
Hmm.
and somebody, whether it's a staff person or an actual participant, doesn't for some reason, but we're not
Right,
aware of that.
right,
And I've certainly had that happen at Wilmot. I had a client who felt that the activity I was providing was kind of beneath him in that
right,
sense. And I did not mean it at all to be, but he felt almost insulted by the activity, but didn't let me know that at all. I ended up
right.
hearing it from his doctor, which
Hmm.
made me, I was glad to hear it because it was important information for me to have, but it also helped me to realize that we need to have ways to proactively reach out to staff or administrators and say, hey, can you give me some feedback? What are you hearing from the participants about the program? Because we don't always, and we can't assume if we haven't heard something that everything has gone well. So figuring
Exactly.
out some ways to proactively reach out and get some even informal feedback about a particular session is really important.
I agree. And I think part of that is when we're engaging with participants, we have to read the facial cues or the hesitancy or the nonverbal response. And we have to deal with all of that immediately. But also, we have to have mechanisms in place to evaluate. And often I would say at the end of my sessions, did you enjoy this? What was hard for you? I noticed that you chose the red plant, not the yellow plant. And then they might reminisce and tell me that their husband passed away. His anniversary was a week ago. So that's, critical, engaging. But yes, we need the other mechanisms, and we need to self evaluate. Like you, I had a program at a dementia care facility, and the administrator just, I wasn't getting good vibes. And finally she said to me with some prompting, and this is the communication skills that we develop. She said, well, all of your activities are childlike. And so then I said, well, they're fun. They're meant to be entertaining. And here's a therapeutic benefit. So I had to go back and happily explain to her that even though we were, I don't know, whatever, making a note card, a Christmas note card, that here were the therapeutic benefits involved in this: hand-eye coordination, cognitive maintenance of following the sequence of tasks. So, yeah, it's an ongoing process. And again, if we become lax or it becomes too routine, then I think that we need to go for more professional development, or attend a conference. Or, I've had peers visit me at my programs. I want to see what I'm doing, and their wonderful feedback. So, there's lots of options out there.
All right. Well, anything else that you'd like to add before you wrap up?
I would say if you are inclined to be a private contractor, go for it. Probably set a time limit, how much time you're going to give yourself to reach a certain level of income and success, and you set your own metrics for success. That way, you're not going to, throw 10 years down the drain and at the end of it realize, oh, geez, this wasn't really working. I think within a family unit, certainly this was my experience, my health benefits were covered by my husband. And so that took one factor off the table. But it can be very rewarding being a contractor. And I think people have started off as private contractors and then been offered full-time employment. And so that can be a pathway into that as well. So, I think you have to be self-aware and think about the populations you want to work with. Certainly, I've lived in communities where there were not organizations who were going to hire me full time, and I had to make my own path. I was committed to the discipline and, I have thoroughly enjoyed it. But now I do spend more time writing than delivering programs. So that's how my professional journey has evolved.
Well, great. Lesley, thank you so much. This has been really wonderful. It's been very educational for me. It's also been kind of energizing for me, just kind of, thinking about all these different aspects. And I do think that one of the advantages we all have is the field is growing, maybe not as
Right.
quickly as we'd all like, but there are more and more opportunities. And I have noticed, with all the struggles with COVID and that we've all been dealing with,
Mhm.
people have become so much more aware of the importance of the outdoors and
Yes,
things like that. So I think that that's just going to continue to grow. And there's
I
just so
think
many different ways for us to engage. But I so appreciate your time
my
and
pleasure.
your expertise. And I think that the students will all feel the same way. And thank you. And I'll look forward to another project with you soon.
Right. Let's collaborate again. Thanks,
Yes,
Lee.
sounds great. Thank you.